Hit Exchange Media Coverage, HIMSS 11.
So Enterprise Intelligence Solutions actually helps healthcare organizations improve their business operations. So it takes all of the data that our healthcare organizations are culminating or collecting and takes that information in, it derives the data and changes that data into information to support improved business processes.
Okay, great. And what are you focused on specifically here at HIMSS? Is there anything new that you're doing that kind of leads into some of the trending that you're seeing within this healthcare technology space?
Obviously, healthcare reform is a huge issue these days, and being able to promote meaningful use and the true intent of meaningful use is a huge focus for McKesson. So having that data and actually being able to improve the business processes so they not just meet the reporting requirements, but they actually improve their operations. In addition to that, healthcare reform is a 5-year ... effort. So we're getting into value-based purchasing. We're talking about how to, from a business perspective, support the accountable care organizations long term. And what does that mean from an efficiency perspective? In addition, most organizations today are trying to figure out how to get their cost structure under control and how to have an operating profit as it relates to Medicare reimbursement rates, as opposed to fee-for-service. So in order to do that, they have to cut 3 to 5% of costs out of their budget annually to make those, or to become and to maintain profitability in the tighter healthcare reform environment. So we are helping provide solutions that help them drive efficiencies across the continuum of care. So our initial focus was in the inpatient market. We now look at the inpatient, tertiary, secondary and tertiary care. We look at the physician, home health, long-term, etc.
Sure, great. You mentioned meaningful use. Are you picking up on any trending related to misconceptions among within meaningful use, and what are you doing to help address those and sort of lead your clients to an appropriate end in that regard?
Misconceptions. There's a lot of lack of understanding out in the marketplace, and that's just because of the complexity of the law and how people are attempting to educate the public on what is required or what is needed. So yes, we have offered extensive webinar education sessions on what meaningful use means in the acute care space and then in the provider space. The misconception is we'll be able to do it quickly and easily. And these measures are very, very complex. And then the rapidity of change and also the clarifications over the coming years, and then in addition, RO stage 1, stage 2, and stage 3, it's not going to be an easy thing to maintain and update. So we as vendors have to come to the table with our partner customers and help them deliver solutions that assist in driving meaningful use to fruition, and also help drive business improvement as well.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.